copying place,
Yeah.
and but I don't want to go there because all these customers are like bodybuilders.
That's okay.
They're like, but they do cupping, like Thai
Yeah.
cupping, and I see their videos every day. Girls competing, and they go to him, all of them, like all competing, and they post it on his site. I'm like, damn, I don't want to go there. Like, I don't want to get embarrassed. Like all these people, like they're in their suits and
Yeah.
buffed, but they do cupping. I was like, maybe I need that.
Well, cupping has
You know,
its
I don't
benefits
know
and
what that
habits. It has its benefits, just like
Okay.
everything else, right?
Okay.
In your shoulder, what I'm noticing, first of all, I did that butterfly test where we put your arm over your head going this way, we
Uh-huh.
put your arm over your head going this way. What I'm checking to see is how the scapula or the shoulder girdle
Uh-huh.
slides to the side, how it raises going up, how it raises coming back down, and I'm testing, pretty much up. I'm testing down. I'm testing out. I'm testing this angle, and I'm also testing this angle coming,
Right.
or I guess you'd say coming back. All that seemed pretty good, other than like the shoulder that was popping in the front there,
Okay.
right? So what could it be? I tested you on a bunch of different things, and the one things that were positive was me bringing it across and kind of squeezing on it a little bit, kind of doing this. Remember when I did this and I kind of like said I'm gonna
When
semi-hug you, and I kind of like pulled it across and I did this.
Uh-huh.
I did that, and I did some empty can stuff. This type of stuff is usually I would normally say a rotator cuff issue, but I actually don't think it's a rotator cuff.
Oh, good.
I don't think it's a rotator cuff issue because you would have had some more symptoms, I believe, from other testing that I was testing on. What I
Right,
do
right.
think is you have an AC joint kind of issue.
Okay.
What does that mean? An AC joint is the acromioclavicular joint. It's where the acromion or the clavicle, here's the acromion of the scapula.
Uh-huh.
It's this little piece of the bone comes to meet our collarbone. So here's our
Okay.
collarbone
The
here.
joint?
It comes here and it kind of relays like this. I'm going to show you on this
Oh, that's fine.
here. This is why I
Yeah.
have these things. It's where
That's this.
this collarbone meets this. It's this joint. But it can create some issues there. So you can see this ligament right here.
Uh-huh. Yeah.
That's where I think you're having the most issue. Sorry.
That
Is
one?
this the coracoacromial ligament? It's named for the the coracoid process, which is right here, and to the acromion process. So this ligament, when it's either injured or irritated, you see this in a lot of bench pressers or shoulder issues and overhead issues, that can get a little irritated. And I put my hands on your muscles and I put my hands around. I was poking around. Nothing caused any discomfort until I did this.
Yeah.
And you're like, oh, right there.
Yeah.
And I even went off to the side. You're like, nah, you didn't say anything.
Right.
And then I went back to there. And you're like,
It's
you're
this.
like, yeah. How'd you know that was there? Because I wasn't aiming for this at first. I was aiming for everything but this. And then as soon as I hit that, that's why I was like out there. I was like, I think we can go back.
Yeah, because you know already.
Yeah.
I didn't even know this piece is here.
Yeah. So, but there's also some ligaments like these two ligaments that are do stability. I think really what you're having is just some irritation. Like I think we can add some of the muscles. By the way, I know somebody told you may have bursitis.
Oh, no, I just read it, you know.
I don't think you have bursitis.
Okay.
The bursa, by the way, is if we
Where's
hide
bursa?
it. Here's the bursa.
Oh, okay. That's
This
fine.
is the subdeltoid bursa. This is called the subacromial bursa. So right under here, the acromion, there
Mhm.
is a bursa that relays right behind here. So sometimes what can happen is this can cause issues when it gets crunched down.
And,
But every time I did stuff like this, what this does, it shortens this movement. And then
Okay.
when I hugged you, it kind of compresses that. So maybe you're getting a little bit of bursitis. Maybe.
Mhm.
I doubt it. But the question would be why. I think the first thing first, this is how I define things. We have 6 baby steps. The first 3 are this. Figure out what the heck is going on.
Mhm.
Now that we know what's going on, you're having some sort of AC joint dysfunction.
Okay.
By the way, when I say dysfunction, what people are like, what does that mean? It just means you're having some irritation in the AC
Right.
joint.
Yeah.
And something's not working right. We already know that. That's why you're here.
Right.
Why is the question. I think you just eventually overloaded this ligament and it's causing a little bit too much strain
Okay.
at this point in time. as a result of that, guess what? Overhead lifting, this type
Inclined
of
and-
movement, empty can usually doesn't use empty can.
Uh-huh.
It doesn't. It usually tests the supraspinatus muscle and the rotator cuff muscle. But in this case, what it does, it does this. It rotates and strains the ligament too. So
Okay.
so when we do this, we're kind of like, it's almost the same movement as this. So if I did this and you brought it across and pulled this across, it would probably hurt a little bit. So if you did that, it probably would hurt.
Right, yeah, I could. see
Yeah,
it.
so it's an AC joint issue. We do a lot of manual therapy in this office. We'll do a lot of other stuff too. But manual therapy is going to help release a lot of the tension.